Hello everyone. Today we'll go through 75 high-yield NCLEX questions to strengthen your grasp of the key concepts. So let's get into the first section of our three-part review. We have question number 1. A disoriented client attempting to remove a central venous device has been prescribed wrist restraints. What is the correct method for applying these restraints? A. Attach restraint straps to the bed frame. B. Secure restraints using a full knot. C. Ensure straps remain loose if the client pulls on them. And D. Allow 3 fingers to fit between the restraint and the client's skin. The answer is letter A. For safety reasons, restraint straps should be attached to a stable surface like the bed frame rather than movable parts such as the side rails, which could cause injury. And take note that letter B is incorrect because full knots are not recommended. We need to do or use that quick release knot such as the half bow, which can allow for rapid removal in emergencies. The same thing with letter C. Restraint straps must stay secure and taut to prevent the client from loosening or removing them. And letter D is also incorrect because we know that the appropriate fit is 1 to 2 fingers between the skin and the restraint to prevent circulation issues while maintaining restraint efficacy. So when you answer this question, look for options prioritizing client safety and quick access in emergencies, especially with the tying technique. So you have to eliminate those choices that do not ensure proper application or safety. Question number 2. Laboratory results reveal that a cancer client is in the nadir phase post-chemotherapy. Which medication should the nurse refrain from giving at this time? A. Guaifenesin, B. Diphenhydramine, C. Acetaminophen, and D. Ibuprofen. The answer is letter D. Because during the nadir phase, chemotherapy can significantly reduce the red blood cells, the white blood cells, and also the platelets, which will increase the risk of the complications. So, if your patient is given an ibuprofen, this can inhibit platelet function, and this should be avoided because this can elevate their risk for bleeding. Now, take note that letter A, guaifenesin, is a cough suppressant. It does not impact blood counts or will increase the patient's bleeding risk. So that is incorrect. The same thing with diphenhydramine and acetaminophen. Let's have number 3. The nurse is teaching a client with newly diagnosed multiple sclerosis. Which statement by the client indicates a correct understanding of managing fatigue? A. I will try to complete all my activities in the morning to get them out of the way. B. Spacing out my activities and taking breaks will help me manage my fatigue. C. I should take long hot baths to relax and reduce my fatigue. And letter D. If I feel tired, I should push through and finish my work quickly. The answer here is letter B, because clients with MS often experience fatigue, which can be one of the most disabling symptoms of this disorder. And the correct way to manage this MS-related fatigue is balancing the activity with their rest, which will help them conserve their energy and also to prevent overexertion. And take note that planning of their tasks and activities throughout the day can help them to have some rest periods to improve their energy levels, and this can prevent long-lasting exhaustion and also avoid exacerbation of their symptoms. So options A, C, and D are all incorrect. If you selected letter A, this can worsen their fatigue. And take note that with MS patients, they need to conserve their energy and make sure that they have to spread out all the activities during the daytime. And for letter C, they're not supposed to take long hot baths because this can exacerbate their MS symptoms, particularly heat intolerance. They have that reduced ability to regulate their body temperature, and also hot environments can trigger their symptoms such as increasing fatigue, muscle weakness, and also their vision problems. If you select the letter D, that is also incorrect, because if they're pushing through their fatigue, this can lead to their exhaustion and can worsen their symptoms as well. Now, when you answer this question, you have to look for those keywords that can align with the best practices, balancing, conserving energy, and also rest. And make sure you eliminate those options that suggest behaviors likely to worsen their symptoms, such as pushing through fatigue or exposure to extreme temperatures. Could be hot baths. Take note that with MS management, it emphasizes on energy conservation and pacing and minimizing factors like heat or overexertion that can increase their fatigue. Let's have number 4. A laboring client's fetal monitor displays late decelerations. What is the nurse's priority intervention? A. Request an order to begin oxytocin infusion. B. Help the client into a squatting position. C. Guide the partner in coaching breathing exercises. D. Administer oxygen through a face mask. The answer is letter D. Take note that late decelerations are caused by uteroplacental insufficiency, wherein there is reduced oxygen delivery to the fetus. And the administration of the oxygen via face mask, around 8 to 10 liters per minute, can help improve the fetal oxygenation. Now, if you selected letter A, that is incorrect because it can intensify the contractions. This can also worsen the uteroplacental insufficiency. And if you selected letter B, this can also worsen the late decelerations. Our patient or our client needs to be in a side-lying position to alleviate uterine pressure on the major blood vessels. So no squatting is advised. Letter C is also incorrect because the breathing techniques do not address oxygen supply to the fetus. So when you encounter this type of question, you have to focus on interventions directly improving oxygen delivery to the fetus and eliminate those actions unrelated to uteroplacental blood flow or oxygenation. Number 5, following defibrillation, a client remains in pulseless ventricular tachycardia. After procainamide administration, what response should the nurse expect? A. Decreased ventricular irritability. B. Transition to ventricular fibrillation. C. Transition to atrial fibrillation. And D. Improvement in consciousness. The answer is letter A. Take note that procainamide is an antidysrhythmic medication that will reduce abnormal electrical activity in the ventricles. It will stabilize the rhythm and will also enhance the likelihood of effective defibrillation. So let's take a little review about the procainamide. This is a drug that belongs to the class 1A antiarrhythmic drugs known for blocking sodium channels in the heart. So what it does, it will slow down electrical conduction. It will prolong the action potential. It can also increase the refractory period, helping to stabilize the abnormal heart rhythm. And this medication is indicated to treat ventricular arrhythmias, specifically ventricular tachycardia. Now, for the side effects here, it can lead to hypotension, can cause nausea, vomiting, fatigue or weakness, and some dizziness or lightheadedness, and often related to the blood pressure changes. Now, for the adverse effects, this is considered as proarrhythmic drug. This can worsen or may cause new arrhythmias, such as torsades, particularly when used for prolonged treatment. And it can also lead to lupus-like syndrome. This can lead to joint pain, fever, rash that will mimic lupus. And aside from that, it can also lead to bone marrow suppression. It's rare, but it's serious. This can lead to low blood counts and can predispose the patient to infections. Now, it can also cause QT prolongation, And make sure when you are administering this medication, you have to give this drug with, of course, EKG or cardiac monitoring in order for you to take a look into those changes in the heart rhythm. And also take note that rapid infusion is not recommended here. It can lead to severe hypotension. So you have to carefully adhere to the recommended infusion. Now, take note about letter B here, transition to ventricular fibrillation. This is a severe dysrhythmia, so this is not the expected effect of the medication. Letter C is also an incorrect answer here. The procainamide targets ventricular dysrhythmias, not atrial condition, and it's not commonly used for long-term management of AFib because of its side effects such as proarrhythmia. And letter D is also incorrect because improved consciousness occurs after the rhythm is stabilized or whenever there is restoration of the cardiac output. Let's have number 6. The nurse is teaching a group of nursing students about eating disorders. Which assessment finding would most likely differentiate anorexia nervosa from bulimia nervosa? A. Presence of lanugo. B. Erosion of dental enamel. C. Frequent episodes of binging and purging. D. Use of laxatives and diuretics. The answer is letter A. Take note that with anorexia nervosa and bulimia nervosa, they are both eating disorders, but they have distinct features. And one of the hallmark signs of anorexia nervosa is the presence of the lanugo, which is the fine, soft body hair that can grow in response to extreme malnutrition. And you will see this in patients with anorexia nervosa due to the body's attempt to conserve heat as a result to significant weight loss and decreased body fat. And this is not something that you will observe in a bulimia nervosa, which does not involve the same degree of malnutrition. If you selected letter B, this is incorrect because this is more characteristic of bulimia nervosa, and this is due to the frequent vomiting associated with the purging, which will expose the teeth to the stomach acid and also can cause the enamel damage. Now, in anorexia nervosa, dental enamel erosion is not a common finding. For letter C, which is also an incorrect option, take note that with the bulimia nervosa, it's characterized with recurrent episodes of binge eating and followed by purging, vomiting, excessive exercise, or excessive use of the laxatives. Whereas anorexia nervosa is typically going to involve with extreme restriction of food intake, and it's not typically associated with binging and purging behavior. And letter D, another incorrect option. The use of the laxatives and the diuretic is more common in bulimia nervosa, but it can also occur in anorexia nervosa. However, this behavior is not the distinguishing feature between the two disorders. Take note that the key difference lies in the presence of the lanugo, which is the fine downy hair due to the chronic malnutrition. So, your technique in answering this type of question is to look for that key physical sign that can differentiate between the two conditions. And you have to eliminate options that describe behaviors like binging and purging, which can be seen in both disorders, and or anything that can point to dental issues, which are more specific to the bulimia nervosa. Let's have number 7. A client receiving gastrostomy tube feedings requires care. Which task can the nurse appropriately delegate to unlicensed assistive personnel? A. Discussing coping strategies with the client. B. Performing mouth care and inspecting the oral cavity. C. Providing a bath and changing bed linens. D. Checking residual volumes of the tube feeding. The answer is letter C. The UAPs are qualified to perform routine tasks like bathing, linen changes, but these do not involve assessment or any kind of clinical judgment. So, no other answer than letter C. So, if you selected letter A, UAPs are not trained to provide therapeutic communication or counseling to clients. They can only assist with oral care. They can um, they can do some basic care, but not doing assessment, especially for assessing the oral cavity. This will require nursing expertise. For letter D, the tube feeding checks. This can also involve nursing assessment and decision making. And so this is the scope of the RN. Let's have number 8. At the beginning of the shift, one RN and one LPN LVN were responsible for 3 newborns in the nursery. 2 hours later, 3 more newborns were admitted, including one needing level 2 care. While the parents of 2 newborns required discharge teaching, the RN is needed exclusively in level 2 nursery to stabilize the newborn. What staffing adjustments should be made to provide adequate care? A. Assign another RN to the nursery to conduct admission assessments and provide discharge education. B. Allow the LPN LVN to complete admission assessments and provide discharge education for 5 level 1 newborns. C. Reassign a UAP from the postpartum unit to handle discharge education in the nursery. And D. Have the RN perform admission assessments while continuing to stabilize the level 2 newborn. The answer here is letter A. Assigning an additional RN can help ensure that the admission assessments and discharge teaching responsibilities, which fall under the RN scope of practice, are handled safely and appropriately. They are specifically trained to perform comprehensive assessments, to analyze findings, and also to implement care plans, also to provide education and evaluate outcomes. If you select letter B, that is incorrect because LPNs, LVNs are not authorized to complete admission assessments or provide discharge teachings because these tasks require critical thinking and judgment that fall within the RN's responsibilities. Letter C is also incorrect because discharge teaching is outside the scope of their practice, and the UAP lack the required training and knowledge to provide this level of education. Now, if you select letter D, another incorrect option, this is really risky because attempting to handle the admission assessments while stabilizing a level 2 newborn can place undue burden on the RN, and this can also compromise both tasks. So don't forget about focusing on the scope of practice and delegation principle. So eliminate those options that assign tasks beyond the capabilities of the LPNs or the LVNs or the UAPs. Let's have number 9. Which intervention would be the priority when caring for a client diagnosed with bulimia nervosa? A. Monitoring for cardiac arrhythmias. B. Discussing body image concerns with the client. C. Administering fluoxetine as prescribed. And D. Encouraging a structured meal plan. The answer is letter A because bulimia nervosa is associated with several severe complications, which includes electrolyte imbalances being one of the most dangerous. Take note that they will frequently have vomiting, excessive use of laxative, and misuse of diuretic, which can lead to significant disruptions in their electrolyte levels, particularly potassium. And this can lead to cardiac dysrhythmias, which can be life-threatening if not managed promptly. So take note. You got to monitor this client for cardiac dysrhythmias. This is the priority intervention. If you selected letter B, this is incorrect. We know that discussing body image disturbance is an important aspect of their treatment, but it's not the priority in the acute phase. We gotta stabilize the client physically, address the electrolyte imbalances, and also take note or to monitor for the cardiac arrhythmias. Now, letter C, another incorrect option here. This fluoxetine, it is a commonly prescribed medication for bulimia nervosa. It can help reduce binging and purging behaviors, but this is not the immediate priority in the acute setting. So before you address psychological aspects with medications, you have to address first life-threatening physical complications such as cardiac dysrhythmias. Letter D, another incorrect option, encouraging a structured meal plan. We know that this is also important, right? But this is going to be much more important during the later stage. We have to address first the physical concerns or the immediate physiological needs of our client, such as the life-threatening cardiac dysrhythmias. Let's have number 10. After a liver transplant, a client is prescribed prednisone and other immunosuppressive medications to prevent organ rejection. Which symptom should the nurse emphasize as a priority to report to the healthcare provider? A, bleeding. B, facial swelling. C, lighter skin pigmentation. D, difficulty swallowing. The answer is letter A. Bleeding is the critical concern because liver function includes regulating the blood clotting, and also the corticosteroids can impair wound healing and also increases the risk of gastrointestinal irritation. So early identification of the bleeding is very important to prevent severe complications. Now, facial swelling in letter B is, or this is what we call as the moon face. This is a common side effect of corticosteroids, but it's not immediately life-threatening. So discard that one. Letter C, another incorrect option. The changes in pigmentations are not related to corticosteroid or immunosuppressive use and do not pose a serious risk. So discard that option as well. Letter D, another incorrect option. Difficulty swallowing is not associated with the prescribed medications in this case. So you have to identify the priority issue by understanding the liver's role in clotting and recognizing corticosteroid-related risks. Let's have number 11. After positioning a client for a wound dressing change and preparing a sterile field with supplies, the nurse hears a page about another client who has fallen in the hallway. What action should the nurse take? A, quickly complete the dressing change, assist the other client, and return to check on the first client. B, secure the safety of the client, discard the sterile supplies, and respond to the fallen client. C, inform the client about the situation, leave the sterile supplies untouched, and attend to the fallen client. D, ensure the client's safety, cover the sterile field with a sterile towel, and respond to the fallen client. Your answer here should be letter D. Because a client fall constitutes a potential emergency, this might require immediate attention. So covering the sterile field can also ensure it remains uncontaminated. It can also allow the procedure to resume without unnecessary waste. So if you select a letter A, that is absolutely incorrect, because completing the procedure can delay attending to the fallen client, and this can compromise their safety. Letter B, another incorrect option. While you are discarding the sterile supplies, this is very necessary. A lot of waste of resources can this going to be much wasteful in this case scenario. Now, if you select letter C, leaving the sterile field unattended can also increase the risk of contamination. So your strategy here should be to eliminate those choices that either compromise client safety or violate sterile technique, and take note that you have to prioritize those immediate response to emergencies while maintaining the integrity of the sterile field. Number 12. A 4-year-old child has been exposed to chickenpox. After receiving information from the nurse, the child's mother repeats the details back. Which statement indicates the mother needs further clarification? A. Chickenpox is a viral illness that can spread to others. B. My child should avoid visiting my pregnant sister right now. C. During the early stage, my child will have chickenpox all over his body. And D. I need to watch for Ray's syndrome, which is a possible complication of chickenpox. Take note, we are going to look for that statement that will require further clarification. So the option is letter C, because the prodromal phase refers to the period before the full manifestation of chickenpox. And during this time, the symptoms such as fever and malaise can occur, but the characteristic rash has not yet spread extensively. So if you select the letter A, this is incorrect, because we know that chickenpox is indeed a contagious viral infection. Same thing with letter B. Pregnant individuals should avoid exposure to chickenpox due to risks to the fetus. And letter D, another incorrect option, because monitoring for Ray's syndrome is appropriate, especially if aspirin is used concurrently. So you have to recall the stages of the chickenpox in order for you to correctly answer this question. So you have to recognize the misconceptions about the prodromal phase of chickenpox. Let's have number 13. Well, let's take a quick break here. So I'm encouraging you to join Stanco's NCLEX Coaching today and get access to 300 hours of engaging animated video lessons. We also have the on-demand videos for your flexible learning, and this also includes 10,000 plus practice questions to sharpen your skills, along with the audiobook and also ebook. And you will also have access to the mock test, the computer adaptive test, and also test series to simulate the real exam. And this also includes the 200 plus NG and NCLEX questions for your comprehensive preparation. Now, I want you to avail this, and you can access our services for the entire 12-month period. So hurry and visit the website stancosnclexcoaching.com to start your journey to NCLEX success. Let's have number 13. A nurse reviews a client's phenytoin level of 7 micrograms per ml. What is the nurse's priority action? A. Assess the client for seizure activity. B. Document the result as normal and continue monitoring. C. Instruct the client to skip the next dose to prevent toxicity. D. Notify the healthcare provider about the subtherapeutic level. The answer is letter D. So, this anticonvulsant drug phenytoin is, it has that narrow therapeutic index. And recall that the therapeutic range is about 10 to 20 micrograms per ml. And so a level of 7 micrograms per ml is subtherapeutic, meaning the medication level is too low and it will no longer be effective in preventing the client's seizure. So your priority here is to take, you have to notify the medical provider to assess the dosage and also to determine if an adjustment of the dose is necessary. So when you have a client that has a seizure disorder, especially if they are taking this particular drug, you have to maintain therapeutic levels. Make sure that you are looking into their drug blood levels in order to have that therapeutic effect of this medication. Now, for letter A, which is one of the incorrect option here, we know that assessing the client for seizure activity is important, but this is not the immediate priority when phenytoin levels are subtherapeutic. And your priority here is to address that low drug level by letting the medical provider know about the subtherapeutic level in order to prevent the seizures. For letter B, another incorrect option, this is incorrect because the phenytoin level is 7 micrograms. It is below the therapeutic range, and the patient here is at risk for seizure. So if you are only going to document and also monitoring, this is leaving your patient at risk for the occurrence of the seizures. Now, letter C, instructing the client to skip the next dose to prevent toxicity. This is a big no-no because skipping can also increase the seizures, all right, because of the subtherapeutic levels already. And so if you are going to let them have this step, this can endanger the patient all the more. So again, your strategy here is to recall the normal range of the medication. Again, that is 10 to 20 micrograms per ml. Let's have number 14. A 24-year-old woman with suspected appendicitis is scheduled for a pelvic ultrasound. What instructions should the nurse provide? A, drink plenty of liquids or fluids to ensure your bladder is full. B, avoid eating or drinking for several hours before the test. C, do not take any oral medications before the exam. D, you will need an enema to cleanse your bowel before the test. The answer is letter A. A full bladder is required for the pelvic ultrasound, as it can enhance the imaging of the pelvic structures by acting on as a acoustic window. So this will help better visualization of the organs like the uterus and also the ovaries. Now, letter B, fasting is not necessary for a pelvic ultrasound as the focus is not on the GI tract. Now, letter C, another incorrect option, withholding oral medications is not typically required for this type of procedure. And letter D, bowel cleansing is also not needed because this is not focused on the colon or the rectum. So you have to eliminate those options that do not directly relate to preparing for a pelvic ultrasound. Again, the question here is about the pelvic ultrasound, and the scenario it's stated about suspected appendicitis is something that is not established yet. So the scenario is asking you to actually think about what interventions or preparations that you should be doing to optimize the imaging of this patient's pelvic cavity or pelvic organs. All right. Let's have number 15. As a representative of the nursing unit on the hospital's quality management committee, the nurse is asked or tasked with assessing the quality of nursing care provided on the unit. Which quality improvement project would be most suitable for involving the team? A, distributing a survey to gather feedback on client and family satisfaction. B, monitoring and recording the frequency of accidents or incidents on the unit. And C, assessing client needs and reporting acuity levels to the shift manager daily. And D, documenting nursing time spent on activities related to direct client care. The answer is letter A. The administration or giving surveys to assess client and family satisfaction is an organized approach to identify and also address gaps in the patient care as well as administrative and support services. For letter B, this is an incorrect option. The incident reports that this option is talking about is something that can help identify risk factors, but cannot directly measure the quality of nursing care. The same thing with letter C. Tracking the acuity levels is more relevant for staff allocation rather than the quality improvement. And Letter D, documenting nursing activities is typically part of efficiency studies, not quality assessment. So you have to focus on the term services in the question stem. And the correct option should involve collecting feedback directly from those who receive the services, which are the clients and their families. Number 16, the nurse is caring for a client with a phenytoin level of 22 micrograms per ml. Which nursing action is most appropriate? A, instruct the client to skip the next dose of phenytoin. B, assess the client for signs of toxicity. C, document the results as within therapeutic range. And D, increase the client's oral fluid intake. The answer is letter B. Remember the therapeutic range of this drug, it's between 10 to 20 micrograms per ml, and 22 is already above the upper limit. So this is a risk of toxicity. So let's recall the manifestations of not digoxin, but phenytoin toxicity, which can include the nystagmus, which are the rapid eye movements. It can include the ataxia. There's going to be incoordination. Patient can be confused. They will also have tremors. They will get dizzy. And your priority nursing care here is to assess the client for signs of toxicity to ensure early detection and also to promptly manage this patient. Now, if the toxicity is already confirmed, you need to make sure that the medical provider adjusts the medication dose, or maybe some other steps will be ordered to manage the elevated drug level. Now, if you selected letter A, this is incorrect because the nurse does not have the authority to independently adjust the medication dosages, and skipping doses may appropriate only under specific instructions from the healthcare provider. Now, the immediate concern here is the elevated level, which is already concern for toxicity. All right, so not just adjusting the dose. So we gotta notify the medical provider. Now, letter C, another incorrect option, documenting the result within the therapeutic range. This is incorrect. Take note that this is already in the toxic range. You have to take appropriate priority here is to take appropriate steps by assessing the client for any signs of toxicity and notify the medical provider right away. Now, letter D, another incorrect option here. We know that hydration is beneficial, but increasing fluid intake is not priority for this patient who has a supratherapeutic level here. So you have to know the therapeutic range of this medication in order for you to target the correct option. So again, the phenytoin has a narrow therapeutic range, and you have to recognize the levels here. Again, 10 to 20 micrograms per ml. Number 17, while setting up breakfast for a client with gastroesophageal reflux disease, the nurse notices a food that should be removed from the tray. Which item should be excluded? A, coffee with cream. B, skim milk. C, egg white omelette. D, dry toast. The answer here is letter A, because food items like coffee, alcohol, fatty meals, and also chocolate can lower the pressure of the lower esophageal sphincter. It will exacerbate the GERD symptoms. And coffee and cream contains fat, which worsens the reflux. Now, letter B, skim milk is incorrect because it's low in fat and it's unlikely to trigger the reflux. Now, letter C, egg white omelette are protein rich, but they do not aggravate the GERD. Dry toast is also mild and it does not pose a risk of reflux. Number 18, a 54-year-old client with liver disease, heart failure, and chronic obstructive pulmonary disease presents with tremors, dizziness, tachycardia, and nausea. The client has a smoking history, weighs 66 kilograms, and is taking theophylline. Which factor most likely contributes to these symptoms? A, liver disease. B, the client's weight. C, smoking history. D, the client's age. The answer is letter A, because theophylline is a drug that is metabolized by the liver, and conditions such as the liver disease can impair the clearance of this medication, which can lead to toxic levels and can lead to symptoms such as tremors and tachycardia. Now, letter B, client's weight does not affect theophylline metabolism unless it's accompanied by extreme obesity or malnutrition. Letter C is also incorrect because smoking increases the metabolism of theophylline. And so if in case the patient does not stop taking or does not stop smoking, they will require higher doses of theophylline, not lower doses. Okay, so this will not cause toxicity. Letter D, another incorrect option. We know that age, it may also affect the metabolism of the drug, but this client is middle-aged, so age is less significant in this case. Let's have number 19. A client has been admitted to the surgical unit after open reduction and internal fixation of a severely fractured right radius and ulna. Which tasks can the nurse delegate to the licensed practical vocational nurse? Select all that apply. A, administer an IV push opioid analgesic. B, elevate the casted arm using 1 or 2 pillows. C, check and record vital signs every hour for 4 hours. D, monitor the cast for drainage and report findings. E, perform hourly neurovascular assessments of the casted arm. Your answer here should be letters B, C, and D. The elevation of the arm can help reduce the swelling, and that is within their scope of practice. And the same thing with letter C. Checking the vital signs is also a basic nursing function appropriate for the LPN and LVN. And also with letter D, observing and reporting drainage on the cast is also a task that can be delegated to the LPN, LVN. So letters A and E are incorrect because IV medication administrations is not within their scope of practice, and the assessment of neurovascular function of the casted arm is a complex type of assessment, and this is going to remain under the RN's responsibility. Again, neurovascular assessment of the casted arm. Take note about the circulation, sensation, and motor function. This is going to fall under the RN's scope of practice with that complex assessment skill. Let's have number 20. The nurse is educating a client taking phenytoin about the importance of routine blood level monitoring. Which statement by the client indicates a need for further teaching? A, I need to have my blood drawn regularly to make sure the dose is safe. B, if I feel dizzy or unsteady, I should skip my next dose. C, the therapeutic range for phenytoin is between 10 and 20. And D, I will report any new symptoms like confusion or slurred speech. The answer is letter B, because the statement here indicates the need for further teaching, because the client should never adjust their medication dosage on their own, even if they experience symptoms like dizziness or unsteadiness. So these symptoms may be signs of phenytoin toxicity, but it is important that any concerns or symptoms are reported to the healthcare provider for further assessment. And the provider is the only one who can determine if the dose should be adjusted, not the patient. All right. So if you select the letters A, C, and D, these are all incorrect. For letter A, this statement reflects an accurate understanding of the need for routine monitoring of phenytoin blood levels. Same thing with letter C. This is a statement that is also accurate with that level there between 10 and 20. Letter D, another statement that is correct. This demonstrates understanding of the phenytoin toxicity as well. Let's have number 21. A client taking bupropion reports trouble sleeping and increased energy. What is the best explanation for this finding? A, the client is experiencing a therapeutic effect. B, the client is showing signs of mania. C, the client is experiencing withdrawal symptoms. And D, the client is having an adverse reaction. The answer is letter A, because bupropion is a stimulating antidepressant and it can work by increasing the energy levels and also the client's alertness. So this can sometimes make people feel more energetic and awake, which is part of the therapeutic effect. It can also cause insomnia when you first start the medication, but this is often temporary side effect while the body starts to adjust. And for some people, they can also experience that boost in energy and alertness as an early sign that the medication is working, even though it might cause a little trouble sleeping at first. Now, letter B is an incorrect option here. We know that the bupropion can sometimes trigger mania in people with a bipolar disorder, but this involves other symptoms like euphoria, impulsivity, and also grandiosity. So just feeling more energetic and having some difficulty sleeping is not enough to suggest mania. And the increased energy is common here, and that's an early response to the bupropion. It doesn't necessarily point to a manic episode unless other symptoms appear. Letter C, another incorrect option here, because the bupropion does not cause withdrawal symptoms like the ones described in the question. So if anything, people might feel more energized or alert when starting the bupropion, not the opposite. Letter D, another incorrect option. We know that insomnia is a known side effect of the bupropion. It's typically mild and temporary, especially when the client just started the medication. So it's not necessarily an adverse reaction unless it becomes severe or persistent. So you have to eliminate those options that are more serious, things like withdrawal symptoms or mania. These are more serious conditions. So the question here describes mild symptoms, which are usually early signs that the medication is doing its job. So you have to focus on the side effects that are commonly seen when starting this medication. Let's have number 22. The nurse is preparing to accompany a client to the treatment area for electroconvulsive therapy. What is the essential pre-treatment requirement? A, ensure the client has consumed adequate fluids. B, verify that the legal spouse signed the consent form. C, confirm the client is wearing snug-fitting clothes. D, check the client has been fasting or NPO. Your answer here should be letter D. Why? Because the ECT involves the administration of anesthesia. It requires fasting to prevent aspiration during the procedure. So if you selected letter A, that is incorrect. This can cause the patient to have aspiration. You don't want this. Letter B is also incorrect because the consent must be signed by the client, not their spouse. Letter C is also incorrect because loose fitting clothes are recommended for comfort and safety. So you have to take note here that our priority here is about the client's safety involving aspiration risk, as we know that this procedure includes or involves the administration of anesthesia. So you have to eliminate options that contradict the NPL requirement for aspiration prevention. Number 23. A mother brings her 3-year-old child to the clinic for a routine checkup. The child hasn't been seen since they were 6 months old. What should be the nurse's top priority during this visit? A. Perform a hearing test. B. Update immunizations. C. Evaluate the child's growth and developmental milestones. And D. Begin education about oral hygiene. The answer here is letter B, because ensuring a child's immunization, that it should be current, is a fundamental nursing priority, especially if their vaccination status is uncertain due to gaps in the healthcare visits. Now, if you selected letter A, performing a hearing test, we know that this is important, but not an immediate concern compared to the immunizations. The same thing with letter C. Growth and developmental assessments can be deferred until after addressing the priority immunization. And same thing with letter D. Dental care guidance is routine and not a pressing issue during this visit. Again, the word priority in this question stem should alert you to actually take note about the history of the child in this case. So you have to choose the action that addresses the most immediate need, which is the vaccination or the immunization need. Let's have number 24. A client on bupropion therapy tells the nurse they are also taking St. John's wort for depression. What is the nurse's best action? A. Tell the client that St. John's wort is safe with bupropion. B. Instruct the client to stop St. John's wort immediately. C. Advise the client to report any signs of serotonin syndrome. D. Notify the healthcare provider immediately. Your answer here should be letter D. When a client is taking bupropion and also using St. John's wort, the nurse's priority is to notify the healthcare provider immediately, because this is known to interact with many medications, including antidepressants such as the bupropion, and can increase the risk of serotonin syndrome, which is a life-threatening condition that can happen when there is an excess serotonin in the brain, which can happen when the St. John's wort is taken with the bupropion. So recall the serotonin syndrome, which can include agitation, confusion, there's increased heart rate, hypertension, there's tremors, and in severe cases, it can lead to seizures and possibly death. And you have to notify the medical provider here as soon as possible. If you selected letters A, B, C, these are all incorrect. Letter A, it's never safe to take St. John's wort with bupropion. Again, that is the serotonin syndrome here. We don't want this happening in this patient. Letter B, instructing the client to stop St. John's wort immediately. What is this? This is partially correct, but not ideal. We know that stopping the St. John's wort is necessary, but you cannot independently make this decision. Only the healthcare provider can make changes to the medication regimen. So your route of action here is to notify the medical provider and to wait for the instructions before telling the client to stop any medications or supplements. Letter C, advise the client to report any signs of serotonin syndrome. This is a good advice, but it's not the best action. Educating the patient about the potential syndrome is part of the care, but notifying the healthcare provider about the manifestation here, okay, should be the priority in order to assess the risk and to manage the situation. Now, Your strategy here is to eliminate those answers that involve independent nursing actions, since nurses cannot independently stop or modify medications without the healthcare provider's order. And you can eliminate options that suggest stopping the supplement or reassuring the client about safety. Now, you have to prioritize the safety of your client here, so you have to look for the answer that ensures immediate involvement of the healthcare provider. When dealing a potentially serious drug interactions like this one, the best action here is to always inform the medical provider as soon as possible. 25. A patient with pancreatitis is experiencing pain. After giving pain medication, which positions should or would the nurse suggest for comfort? Select all that apply. A. Lying on the side with knees drawn to the chest. B. Resting on the left side without bending the knees. And C. Sitting upright while leaning forward. And D. Lying flat on the stomach. And E. Lying on the back. The answers here are letters A and C. The pancreatic pain is often alleviated by sitting, leaning forward, which can reduce the pressure on the inflamed pancreas. And the fetal position, or the side lying with the knees bent, can also help the abdominal wall. It can also reduce the discomfort. The supine or the prone positions are typically uncomfortable due to the increased pancreatic pressure against the abdominal wall. So your strategy here is to focus on how different positions affect the abdominal pressure. Eliminate those options that increase the pressure on the inflamed pancreas. So you're again invited to enroll to our NCLEX course and visit at stankosnclexcoaching.com for more details. So this is the end of the first. A nurse is caring for a resident with dysthymic disorder in a long-term care facility. What intervention is most important to include in the care plan? A. Encourage the resident to eat in the dining area with others. B. Ensuring the resident has 2 hours of uninterrupted quiet time each morning. C. Include 2 liters of clear liquids daily in the resident's diet. And D. Provide 3 structured meals per day without snacks. The answer here is letter A, because individuals with dysthymic disorder often struggle with social withdrawal, and eating in a communal setting promotes social interaction. So this will reduce feelings of isolation. Now, quiet time, meal structure, and fluid intake, while we know that these are beneficial in other contexts, but will not directly address social isolation. So you have to look for the keyword dysthymic disorder, which indicates a focus on the mood and social intervention. So you got to eliminate options unrelated to improving social engagement. 27. The nurse is caring for a client with DKA receiving irregular insulin infusion. The client's serum potassium level is 3.2 milliequivalents per liter. Which action should the nurse take first? A. Stop the insulin infusion immediately. B. Administer potassium replacement as prescribed. C. Increase the rate of the insulin infusion. D. Place the client in Trendelenburg's position. The answer is letter B. The client in this case has a serum potassium of 3.2 milliequivalents per liter, which is low, and another complication of insulin therapy, especially for those patients treated, for those patients with DKA. Now, take note that insulin promotes the shifting of the serum potassium from the blood into the cells, which can lead to dangerously low potassium levels. Now, this will require immediate attention in order to prevent serious complications such as cardiac dysrhythmias and muscle weakness. So your priority here is to administer potassium replacement as prescribed to correct the hypokalemia and to prevent the life-threatening cardiac dysrhythmias. If you selected letter A, stop the insulin infusion immediately, is incorrect because this should not be disrupted, especially that you're treating the patient with a DKA, which is the underlying issue that requires continuous insulin to reduce their elevated blood glucose to correct the ketosis. This infusion should continue, but the potassium replacement should also occur to avoid the complications. Now, if you selected letter C, this is incorrect because increasing the insulin rate can also worsen the hypokalemia. It will cost more serum, or it will cost more of the potassium ions to go inside the cells. So this is something that you should discard right away. Now, letter D, place the client in Trendelenburg's position, because this is not really necessary in treating a DKA. This is something that you will be using when a patient is in a state of shock or low blood pressure, but it will not address the immediate danger of hypokalemia. Now let's have number 28. A patient on IV heparin has an activated partial thermoplastin time of 140 seconds, control of 36 seconds. What action should the nurse prioritize? A. Repeat the APTT in 1 hour and continue monitoring. B. Increase the heparin dose and check APTT again in 6 hours. C. Stop heparin for 6 hours, then restart at the same rate. And D. Pause heparin for 1 hour, restart at a lower dose, and recheck APTT in 2 to 3 hours. The answer here is letter D. An APTT level of 140 seconds is already in excess. It exceeds the therapeutic levels. So this can pose a bleeding risk to your patient. So this will require you to stop the heparin briefly and to restart at a reduced dose to allow for a safe re-establishment of the therapeutic level. So increasing the dose or continuing the infusion here can lead to severe complications, and you should not do that, especially that the APTT is already very high. And also, when you are prolonging the cessation of the IV infusion, also undermines the anticoagulation control. Now, letter A is an incorrect option here. Continuing the heparin without adjustment can really put the patient at risk for bleeding, massive bleeding. For letter B, increasing the dose of the infusion can also worsen the client's bleeding risk. And to select letter C, stopping the heparin for 6 hours, this is quite a lengthy cessation of that infusion. This will really disrupt the anticoagulation goal. And so you have to recognize the critical nature of a high APTT value in this case and choose the option balancing the client's safety and also the therapeutic goals. 29. A medical unit RN is floated to the surgical unit. Which post-op patient is the most suitable assignment for this nurse? A. A patient post-thyroidectomy at risk for low calcium. B. A patient 2 days post-cardiac valve replacement. C. A patient post-laparoscopic gallbladder removal with lung disease. And D. A patient post-hip replacement for arthritis. The answer here is letter C, because this procedure has minimal complications, and managing a patient with chronic lung disease also aligns the RN's medical background. All right. So the other patients that are in the other options require specialized surgical care, such as cardiac monitoring or airway management, which are better suited to experienced surgical staff. Now, if you selected letter A, of course, that's incorrect, right? The patient here will require close monitoring for hypocalcemia and airway issues. Not going to be a suitable patient for the float nurse here. Same thing with letter B. Cardiac surgery patients require also expertise in monitoring and preventing complications. And letter D, post-hip replacement care often involves physical therapy and surgical specific protocols. So not the best suitable patient for this float nurse. So when you are going to be asked with this type of question, you have to match the nurse's expertise with the complexity of the care required, and you eliminate those options requiring specialized surgical knowledge. Number 30, the nurse is assessing a client who has been diagnosed with avolition. Which of the following observations best reflects the client's condition? A, the client sits quietly in their chair and has not bathed in days. B, the client becomes agitated when asked to participate in group activities. C, the client expresses a wide range of emotions during a conversation. And D, the client complains of dizziness when attempting to stand. Your answer here should be letter A, because avolition is a symptom of schizophrenia that involves the lack of motivation to initiate and engage in activities, even those that are necessary for daily functioning, like bathing, eating, or participating in social interactions. Now, the client with avolition may sit passively, avoid social interactions, and also neglect personal hygiene. So in this case, the client sitting quietly without bathing for several days reflects this lack of motivation and disengagement from basic self-care activities, which is a key characteristic of avolition. Now, why letter B, C, and D are incorrect option? We know that with letter B, we know that agitation can be a symptom of schizophrenia, but it's not characteristic of avolition. Again, avolition primarily manifests as the lack of motivation and passive withdrawal rather than agitation. Same thing with letter C. This is also incorrect. Clients with avolition often have a flattened affect, which means they may show little or no emotional expression. Now, a wide range of emotions is more consistent with a person who is emotionally engaged in a conversation, but this contradicts the lack of motivation and emotional blunting seen in avolition. So this is not a reflection of avolition. Letter D is also incorrect. Dizziness is a physical symptom that could indicate issues like orthostatic hypotension or other medical conditions, but it is unrelated to avolition. This symptom does not speak to the client's motivation or engagement and does not reflect the lack of goal-directed behavior seen in avolition. Again, your strategy here is to look for the key symptoms. When asked about a mental health condition like avolition, you have to focus on behavioral characteristics like lack of initiative or disengagement from activities such as hygiene, work, or social interactions. Question number 31. An adult male client with venous stasis ulcers is treated with an Una boot. Which additional care measures should the nurse include in the care plan? Select all that apply. A, elevate the legs when possible. B, stand frequently to encourage circulation. C, apply wet to dry dressings to the ulcer twice daily. And D, keep the legs in a lowered position for comfort. E, check peripheral pulses regularly. The answers here are letters A and E. Letter A is correct because this promotes blood return to the heart. This can help alleviate the symptoms of venous insufficiencies, which is basically the underlying problem in the venous stasis ulcers. And letter E, this will also ensure the proper circulation and verifying that the compression from the Una boot is not impairing arterial blood flow. Now, letter B is incorrect because it can worsen the venous stasis by allowing gravity to impede the blood return. Same thing with letter C, another incorrect option, because wet to dry dressings are not typically used with an Una boot because the dressing provides compression and remains in place for extended periods. Letter D is also incorrect because keeping the legs dependent will contradict the goal of relieving venous congestion and promoting healing. So what will be your strategy in answering this question? Well, you have to identify the issue first, which is the venous insufficiency. And you have to recognize that intervention should enhance venous return and circulations. And you have to eliminate those options that contradict these goals and those that are not aligned with the standard care practices for the UNA boot. Let's have 32. A nurse from the surgical intermediate care is floated to a medical surgical unit for the day shift. Which clients are most appropriate to assign to this nurse? Select all that apply. A client recovering from emergency appendectomy surgery during the night. B, a client admitted with severe hyperthyroidism or thyrotoxicosis. C, a client with kidney stones scheduled for lithotripsy this morning. And D, a client newly diagnosed with worsening heart failure. And E, a client recently diagnosed with type 2 diabetes requiring education. Your answer here should be letters A and C, because this client requires routine post-op care, which aligns with the surgical intermediate care nurse's expertise. For letter C, the pre-procedure care for lithotripsy falls within the surgical nurse's skill set, and it also involves typical pre-op preparation. Now, why not letter B, D, and E? Well, of course, the thyrotoxicosis in letter B is a medical issue, and it typically requires care from a nurse experienced with endocrine conditions. Now, with a patient that has a heart failure or worsening heart failure in letter D, this is something that can be managed with a nurse familiar with cardiac care. With letter E is also incorrect, because education about diabetes management is complex and also requires expertise in teaching this client population. Now, your focus in answering this question is to you have to be conscious about the float nurse's background, their expertise, all right? And you have to select clients with conditions related to surgical or pre-procedural care, and make sure that you're going to eliminate those options that have medical conditions requiring specialized knowledge outside the nurse's training. 33. A client with schizophrenia exhibits symptoms of avolition. What is the nurse's priority goal for the client? A, develop meaningful relationships with family members. B, participate in one structured activity each day. C, verbalize feelings about their condition. And D, demonstrate improved balance and coordination. The answer is letter B, because the avolition is a symptom of schizophrenia where a person has a lack of motivation to start or complete task. They will show little interest in activities that require effort, like personal care, work, or social interaction. And your priority goal here is to help the client engage in at least one structured activity each day. So this is something that will be both realistic and achievable, which is important when working with a client who has abolition. Now, you have to start with small tasks and gradually increase their involvement. And you're also going to help the client build motivation and a sense of accomplishment, which can improve their overall engagement and functioning. We have number 34. A parent asks how to handle rough edges of their child's casts, which are causing skin irritation. What should the nurse recommend? A, attach a soft towel to the cast's edge for protection. B, apply adhesive tape to the cast edges, folding strips over from the inside to outside. C, use petroleum jelly on the skin around the cast edges to reduce irritation or friction. And D, contact the healthcare provider to remove rough edges. Your answer should be letter B. This is what we call as pettling the cast edges with the use of the adhesive tape, which will provide effective solution to the rough edges. It will protect the skin without compromising the cast's integrity. Now, letter A is an incorrect option because this can cause uneven pressure and may not provide adequate protection. And for the petroleum jelly in letter C can lead to skin maceration. It will increase risk of irritation and infection. Now, letter D, contacting the healthcare provider, is also incorrect because it's unnecessary for this routine issue. Now, for you to answer this type of question, you have to visualize the options and then start to eliminate impractical solutions. Now, you have to recall the patenting, which is a standard nursing intervention for addressing the rough cast edges. 35. On the postpartum unit, which task is most appropriate to delegate to a beginning nursing student? A. Conduct an admission assessment for a newly admitted postpartum client. B. Call the healthcare provider to report a critically low hemoglobin level. C. Verify blood unit compatibility before initiating a transfusion. And D. Assist a client who had a cesarean section 2 days ago with ambulation. The answer is letter D. This is a basic task that is suitable for a beginner student with limited clinical judgment. Letter A is incorrect. Same thing with letter B and C. The admission assessment can require advanced critical thinking and clinical expertise. For letter B, reporting critically low hemoglobin level is a task that requires judgment and also communication skills beyond the scope of a student. Now, the verification of blood unit compatibility should be done by 2 licensed nurses for safety reasons. Let's have number 36. A nurse is caring for a client diagnosed with systemic lupus erythematosus who reports significant joint pain and fatigue. What is the most appropriate nursing intervention? A. Encourage the client to increase physical activity despite fatigue. B. Provide a warm, quiet environment to promote rest. C. Educate the client on avoiding direct sunlight. And D. Suggest participation in support groups for chronic illness. Your answer here should be letter B, because this SLE, take note that fatigue and joint inflammation, pain are common during the acute exacerbations. And during the flare-ups, the body's inflammatory processes are at its peak. This can lead to increasing fatigue, discomfort. And so your priority here should be to promote rest and avoid overexertion, which is something that you should think about. Now, creating a quiet environment can help also reduce their stress and also enhance their comfort and making it easier for the client to rest and recover. Now, if you selected letter A, encourage the client to increase physical activity despite fatigue, no. During an exacerbation, this is something that you should avoid doing. Now, if you selected letter C, educating the client on avoiding direct sunlight, this is an important part of your care of this patient, but this is particularly necessary for those clients with skin manifestations like the butterfly rash, which can be triggered or worsened by the sun exposure. But then again, the action does not directly address the symptoms of fatigue, joint pain that the client is experiencing in this case. So again, your goal, your priority here is to prevent over fatigue, over exhaustion. You got to promote physical rest this time. Number 37, a client scheduled for a barium enema expresses concern about potential bowel obstruction from retained barium. What is the most appropriate response by the nurse? A. Would you prefer to reschedule the test for a later time? B. Don't worry, the provider will ensure all the barium is removed after the test. C. You will receive extra oral fluids, laxatives, and possibly an enema if the barium isn't expelled in 24 hours. D, the type of barium used won't lead to an obstruction. The answer here is letter C. After a barium enema, the concern about retained barium is valid, and it can lead to constipation. It can also lead to bowel obstruction if not properly managed. Now, for you to address this, patients are going to be instructed to increase their oral fluids. They may be given laxatives and also given an enema if the barium isn't expelled within a 24-hour period. So these are standard protocols to help the body expel any remaining barium and prevent complications such as impaction and obstruction. Let's have number 38. Now, we are inviting you to enroll to our NCLEX course via NCLEXcoaching.com and take note about the perks that you're going to get with your subscription. You have the 10,000 plus practice questions, the audiobook, ebook, and also the 200 plus NGN NCLEX questions that is included for the 12-month access. Let's have question number 38. A client with heart failure is instructed to adhere to a diet limiting sodium intake to 2 grams per day. Which statement by the client reflects that the dietary instructions were understood? A, I can add a pinch of salt to my food during cooking. B, I just need to avoid salty snacks like chips. C, I should steer clear of processed and canned foods. And D, as long as I stop salting my food, I'll be fine. The answer here is letter C. The patient response here demonstrates a clear understanding of the dietary restrictions for a 2-gram sodium restricted diet. Take note that the processed canned foods are very notorious for containing hidden sodium, even if they didn't taste salty. And so by avoiding these foods and focusing on fresh and processed ingredients, the client can significantly reduce their sodium intake. And make sure that they are taught on reading labels, which is very critical because sodium can be present in unexpected items like bread, sauces, and also other condiments. Now, if you select the letter A, this is an incorrect option because even a small amount of table salt adds a considerable amount of sodium, which is not permissible in a 2-gram sodium diet. And take note that 1 teaspoon of salt contains about 2,300 milligrams of sodium, which exceeds the daily limit with just a small pinch. Now, if you select the letters B, I just need to avoid salty snacks like chips. This is a good step, but it's not sufficient. There are many food items like processed meats, canned soups, frozen meals, which contain high levels of sodium without being noticeably salty. And so the sodium restriction requires more than just avoiding salty foods. The same thing with letter D this is something that you should be discarding here because simply eliminating added table salt does not address hidden sodium found in many processed and prepackaged foods. And you have to take a more comprehensive approach that includes label reading and avoiding high sodium items, which are also essential. Now, for you to answer this test question, you have to focus on the key term 2-gram sodium diet. So this strict dietary limit requires the patient to avoid both visible sources of sodium like table salt and hidden sources such as processed foods. Number 39. During a conversation with a client at a mental health clinic, the nurse notices the client becoming increasingly anxious. What should the nurse do? A, suggest relaxation techniques such as guided imagery, and B, ask focused questions to uncover the specific stressor, and C, inquire if the client wants to stop the discussion, and D, shift the focus to a less distressing topic? The answer is letter D. You have to redirect the conversation to lower the anxiety levels by removing the focus from distressing topics. And we know that probing can further or abruptly stopping the session could heighten the discomfort, while the relaxation techniques may not be effective at the moment. Now, letter B, asking or ask focused questions to uncover the specific stressor. This is something that can exacerbate anxiety by forcing the client to delve deeper into the stressor. Big no. Same thing with letter C. Asking the client whether to stop may also put undue pressure on them and may also increase their anxiety. Now, for you to answer this question, you have to identify the primary issue, managing acute anxiety. And you have to use the elimination strategy to select the action that decreases immediate distress while maintaining rapport with the patient. Number 40. A nurse is reviewing the laboratory results of a client with systemic lupus erythematosus experiencing an acute exacerbation. Which lab finding should the nurse anticipate? A, elevated white blood cell count. B, decreased hemoglobin and hematocrit. C, increased platelet count. And D, elevated sodium levels. The answer is letter B, because in SLE, anemia is a common finding, especially during an acute exacerbation. And this is known as anemia of chronic disease, which results from persistent inflammation and immune-mediated processes that will suppress red blood cell production. And in addition to that, hemolysis can also occur due to the formation of the autoantibodies against the red blood cells, which will further contribute to the low H&H. Now, if you selected the letter A, this is incorrect because an elevated white blood cell count is not typical in SLE. What you will see more in patients with SLE, they're gonna have leukopenia due to the bone marrow suppression or its treatments like immunosuppressants or corticosteroids. And while infection may cause a white blood cell increase, it's not directly related to SLE exacerbations. Now for letter C, another incorrect option here because thrombocytopenia or low platelet counts are more commonly seen in clients with SLE. Because the autoimmune process can target the platelets, it will reduce their numbers. And for letter D here, sodium levels that are elevated, this is not characteristic of SLE as well. Okay, let's have number 41. The nurse is educating the parents of a child diagnosed with cystic fibrosis on proper cleaning techniques for the nebulizer equipment to prevent infections. Which statement by the parents indicates a need for further teaching? A, we will clean the nebulizer mask and cup with warm soapy water after each use. B, we can clean the tubing by rinsing it out with warm water. C, we should allow the nebulizer parts to air dry completely after cleaning. And D, once a week, we will disinfect the mask and cup using vinegar solution. Again, you are going to identify that statement that indicates a need for further teaching. That is letter B. This reflects misunderstanding of proper nebulizer kit care because the tubing should not be rinsed with water because water can become trapped inside. It will create a moist environment conducive to bacteria and fungal growth. So what you're going to do here instead is teach the family to replace it regularly as part of the maintenance protocol. So this will also ensure integrity and hygiene of the equipment, particularly for a child with the cystic fibrosis, which is highly susceptible to the respiratory infections. Now, letter A is an incorrect option because cleaning the nebulizer mask and cup with warm water and soapy water after each use is essential. So this will basically remove residual medication debris. It will prevent bacterial growth and infection risk. The same thing with letter C and letter D. These actions will also prevent the possibility of buildup of water inside the kit and will prevent possible infections. 42. The nurse is caring for a child suspected of having epiglottitis. Which intervention should be avoided during the initial assessment? A. Visual inspection of the throat with a tongue depressor. B. Providing oxygen via non-breather mask. C. Positioning the child in a sitting position. And D. Monitoring oxygen saturation continuously. Take note about the question here. Which intervention should be avoided during the initial assessment? That would be letter A. So in a suspected epiglottitis, the visual inspection of the throat using tongue depressor is strictly contraindicated because the inflamed epiglottis can be extremely sensitive. And so attempting to visualize it can trigger a reflex spasm. It can cause complete airway obstruction, which will rapidly lead to a life-threatening emergency. And so what you need to do here instead, it's the diagnosis is confirmed through clinical science, use of imaging like lateral neck x-ray, which will show that thumbprint sign. Now, letter B is incorrect here. Providing oxygen via non-breather mask, the same thing with C and D. These are actions that can help treat this pediatric patient with epiglottitis. Take note about the positioning here in letter C. Upright positioning is recommended because it can maximize the airway patency by using gravity to reduce pressure on the airway, and it also increase, or it will ease the respiratory effort. Now, what you will see in a pediatric patient with epiglottitis, they assume that tripod position. They will lean over to optimize their breathing. Now, letter D, which is an intervention, basically monitoring oxygen saturation continuously. This is a good intervention. This is very important for us to detect hypoxia promptly. We have to detect and recognize any hypoxemia. Let's have number 43. The nurse is preparing a client for discharge with a prescription for lithium carbonate. Which statement demonstrates the client's understanding of the medication? A. I dislike lithium, but I'll take it daily, get my labs done, and enjoy my usual activities while waiting for it to take effect. B. I hate the shaking, but I'll take the medication with meals and come back next month for my appointment. C. Taking lithium every day means I won't have to return to the hospital. D. I don't want to take it, but you said I must. The answer here is letter A, because this response reflects a realistic understanding of the medication's administration, the side effects, and the timeline of the effectiveness, which indicates the client's willingness to adhere to the treatment plan. If you selected letter B, acknowledging the side effects but not expressing acceptance of the medication routine suggests incomplete understanding. For letter C, this is another incorrect option because believing lithium completely prevents hospitalization also demonstrates a lack of understanding of its purpose. For letter D, this is also incorrect because expressing refusal to take the medication indicates non-compliance and lack of readiness for discharge. So when you're going to encounter this type of question, you have to choose the statement showing acceptance of the treatment. understanding of the medication's purpose and the awareness of the drug's side effects. 44. A client is scheduled for outpatient allergy testing. What should the nurse prioritize during the initial testing? A. Prepare the examination area before the client arrives. B. Provide discharge instructions before testing begins. And C. Ensure emergency equipment is readily available. And D. Advise the client to wear a t-shirt for easier access to test sites. The answer is letter C, because the allergy testing poses a risk for severe allergic reactions, and this includes anaphylaxis. And so you got to make sure that emergency resuscitation equipment is available readily to address potential complications immediately. Now, letter A is incorrect because this is just essential, but it doesn't really address client safety during the procedure and doesn't really going to help out a possible anaphylaxis response. Letter B, providing discharge instructions before the testing begins. This is something that is provided after ensuring the client has no adverse reactions. And appropriate clothing is helpful, but not critical to the client's safety. Let's have number 45. A client has sustained a traumatic brain injury. Which of the following assessment findings indicates Cushing's triad? A. Hypotension, tachycardia, and narrowing pulse pressure. B. Irregular respirations, bradycardia, and widening pulse pressure. And C. Tachypnea, tachycardia, and fixed pupils. D. Jugular venous distension, muffled heart sounds, and hypotension. The answer is letter B. The Cushing's triad is the classic set of symptoms that indicate increased intracranial pressure and impending brain herniation. So these are the manifestations. There will be irregular respirations, which occurs from brainstem dysfunction caused by the compression. Another is bradycardia, which is a reflex response to the increased ICP. We know that the vagus nerve is stimulated by the pressure on the medulla. And there's also widening pulse pressure. And this is something that is caused by a rise in the systolic blood pressure due to a compensatory mechanism attempting to maintain cerebral perfusion. Again, don't forget irregular respirations, bradycardia, and widening pulse pressure. And so these findings are late signs of increased ICP and will require immediate intervention to prevent catastrophic outcomes. Now, letter A here, hypotension, tachycardia, and narrowing pulse pressure. These are findings of shock, particularly hypovolemic or distributive type of shock, not Cushing's triad. If you select the letter C, tachypnea, tachycardia, and fixed pupils, these indicate severe brain damage or brain herniation. But the fixed pupils I'm talking about, the fixed pupils indicate the severe brain damage and brain herniation. But the tachypnea and tachycardia, they're not components of the Cushing's triad. The tachypnea may result from the metabolic acidosis or other causes, but does not reflect increased ICP. For letter D, we have here the jugular venous distension, muffled heart sounds, and hypotension. These are what we call as the components of the Beck's triad associated with cardiac tamponade and not related to increasing ICP. Now you have to really understand and recall the different triads or syndromes here. Again, Cushing's triad is basically associated with increasing ICP. However, the Beck's triad is associated with cardiac tamponade, and we also have the manifestations of the shock or the hypovolemia. So make sure that you differentiate those manifestations. Let's have number 46. The nurse is teaching a client about administering dipivefovrin eye drops. What instruction is most appropriate? A, avoid blinking for 30 seconds after applying the drops. B, keeping your eyes closed for a full minute after administration. And C, gently squeeze your eyes shut for 30 seconds immediately after application. And D, close your eyes lightly but avoid squeezing after applying the drops. The answer here is letter A. Avoiding blinking for 30 seconds will help prevent the medication from being washed away or forced out of the conjunctival sac, which will help enhance absorption and effectiveness of the eye drop. So this is a technique that will help ensure the medication remains in contact with the ocular surface where it can be absorbed efficiently. If you select letter B, which is incorrect, if you're going to keep the eyes closed for a full minute, this is necessary for optimal absorption. And prolonged closure will not provide additional benefit and could be inconvenient to the client. Option C, gently squeezing the eyes shut can also cause the medication to be forced out of the eye. It will reduce the medication efficacy. And this also counteracts the goal of maintaining the drops on the ocular surface. Letter D is also incorrect. We know that lightly closing the eyes may reduce spillage, but it's less effective than avoiding blinking entirely. So lightly closing the eyes does not optimize absorption as effectively as keeping them open without blinking for a brief period. Let's have number 47. The nurse is teaching a client about administering dipivefrin eye drops. What instruction is most appropriate? I believe this is a repeated item. Let's shift into another item. Number 47. A client who recently had a tuberculin TB skin test sees the nurse to discuss the results. The test in duration and the client asks about its significance. How should the nurse respond? A, if the test is positive, it means you have active tuberculosis and must be isolated immediately. B, false positives are common. You likely need a retest in 6 months. And C, a positive result indicates that you're contagious and need to begin treatment right away. And D, a positive test indicates TB exposure, but it doesn't confirm active infection. Additional tests will be needed. The answer is letter D. A positive skin test or a positive TB skin test signifies the presence of the TB organism. Either it's active or dormant. It does not confirm active disease. So the client should expect follow-up tests such as sputum culture in order to detect the bacillus, and also a chest x-ray to check for active infection or lesions. And so the isolation is unnecessary unless active TB is diagnosed, and treatment is not initiated until an active infection is also confirmed. So if you select letter A, this is incorrect, because active TB is not diagnosed solely through a positive skin test, and isolation without further testing is also inappropriate. Letter B, another incorrect option here, because delaying further evaluation by 6 months could endanger the client and others. And the same thing with letter C, another incorrect option. A positive test does not confirm active TB or infectiousness, and so immediate medication is not required. So you have to focus on the purpose of a TB skin test, and remember, it identifies exposure, not active disease, and use the process of elimination to discard the answer suggesting immediate isolation or delayed action. Number 48. A cancer patient lab results reveal a calcium level of 11.9 milligrams per deciliter. Which symptom should prompt the nurse to notify the healthcare provider? A, weakness in muscles. B, muscle cramping or spasms. C, elevated T waves on the ECG. and D, faster movement in the digestive system. The answer here is letter A. Take note about the normal calcium levels, the range. It's supposed to be at 8.5 to 10.5 milligrams per deciliter. And so the 11.9 milligrams per DL is already hypercalcemia, which will reduce the neuromuscular excitability. It will lead to muscle weakness, and this is something that you can see in cancer patients due to the bone resorption or tumor related effects. Now, if you select the letters B, C, and D, these are all incorrect. The muscle cramping or spasms are linked to the hypocalcemia, not hypercalcemia. Letter C is also incorrect. What we are going to expect here, the peak T waves are associated with hyperkalemia, not high calcium. And for letter D, faster movement or increased peristalsis is also unrelated to hypercalcemia. Number 49. A hospitalized client who has been taking hydralazine for years at home develops a blood pressure of 76/43 mmHg 1 hour after a 20 milligram oral dose. What likely caused this hypotension? A, potassium level of 5.7 milliequivalents per liter. B, the dose of hydralazine is too high. C, a rapid heart rate of 146 beats per minute. And D, 980 mLs fluid intake over the past 24 hours. The answer is letter D. You have to recall that hydralazine is a vasodilator. It will reduce the blood pressure. And so, noting the 980 mLs intake of fluid in an entire 24-hour period is already considered dehydration. It's going to decrease the circulating volume, it can lower the preload, and it will exacerbate the hypotensive effect. And so take note about the 20 milligrams that the patient has taken. It's within the recommended dosing range. And the high potassium level that you are seeing in letter A, it's unrelated. And the increased heart rate is a compensatory response to the hypotension. So letter A, the elevated potassium does not affect the hydralazine's action. And you have letter C there, tachycardia, which is a compensatory response to the low blood pressure. So you have to recognize that hydration affects blood pressure, and you have to rule out unrelated factors like potassium and focus on the circulation dynamics. We have number 50. A client with diabetes insipidus using intranasal desmopressin presents with disorientation, behavioral changes, and noticeable foot swelling. What is the nurse's priority action? A, advise reducing salt intake temporarily. B, schedule a follow-up visit for reassessment. C, suggest switching to subcutaneous desmopressin. And D, measure vital signs and alert the healthcare provider. Your answer here should be letter D. The patient here has an overdose of desmopressin, which can lead to fluid retention and sodium imbalance. The patient's manifestations here, we have disorientation, behavioral changes, foot swelling. These are signs of fluid overload, and you should be prompt in notifying the medical provider here and making sure that you measure the patient's vital signs right away. All right. If you're going to delay the reassessment of this patient, you can also delay the treatment. So if you selected letter A, which is an incorrect option, this will not resolve the underlying issue, and the routine administration is not the problem. The route of the administration is not the problem. So you're also going to eliminate letter C. So what will be your clue here in answering this test question? You have to identify the signs and symptoms of desmopressin toxicity, which is basically there is overdose of the antidiuretic hormone. Think about the fluid overload or fluid retention, which can affect the sodium levels, which will lead to neurological changes such as disorientation. You have to notify the medical provider here. So this is the end of our second part of the 75 questions. And so we are also inviting you to enroll to the NCLEX course and check out the website at NCLEXcoaching.com. I'll see you again in the next series. A client recently diagnosed with Alzheimer's disease becomes confused at night. What initial recommendation can the nurse offer family caregivers? A. Play calming music or television in the bedroom. B. Encourage walks in the neighborhood to improve sleep. C. Use soft indirect lighting in the bedroom at night. And D. Lock the client's windows and bedroom door. The answer here should be letter C. With the use of the soft indirect lighting in the bedroom can help clients with Alzheimer's disease to recognize their surroundings, which can also reduce their disorientation and nighttime confusion. And remember that Alzheimer's disease often disrupts the body's circadian rhythm, and this can lead to nighttime agitation or confusion, known as the sundowning syndrome. And providing gentle lighting can also create a much more calming environment that will promote their safety and orientation without overstimulation. Now, if you select letter A, this is an incorrect option because with continuous auditory stimuli, even if calming, can worsen disorientation or it might disrupt their sleep. And take note that with Alzheimer's disease, they're often more sensitive to sensory input, which can also lead to their agitation and can further their confusion. Now, for letter B, this is also incorrect. We know that physical activity like walking is beneficial for overall health, but it does not directly address the nighttime confusion. And in addition to that, evening walks may also pose a safety risk for persons with Alzheimer's, particularly if they become disoriented or they'll start wandering. Now, letter D is another incorrect option because securing the environment we know that this is an important step, right, to ensure their safety, especially to prevent wandering. But locking the client in their room can create feelings of fear and also entrapment. It will not help with reorientation, or it will not help reduce the confusion, which is the primary issue in this scenario. So what we'll do here is to prioritize those interventions that promote safety, promote orientation, and promote a calming environment. So you have to eliminate those options like playing music or television in letter A, or locking the client's door in letter D. These could exacerbate confusion or cause distress, making them unlikely choices. And so you gotta select that practical, immediate solution, especially for the nighttime confusion, which will require actions that are simple, effective, such as using soft lighting to allow familiarization of their environment. So you have to avoid those solutions that will not address the core issue, especially like walking. Said here about walking in the neighborhood to improve sleep. This is only beneficial for general health, but specifically will not mitigate nighttime confusion. Let's have number 52. A home health nurse evaluates the safety of home for an elderly woman recently discharged from the hospital. Which hazards should the nurse address with the client's daughter who is overseeing home care? Select all that, apply. A pile of magazines placed on the floor beside the client's chair. B, the light at the top of the staircase is non-functional. C, decorative rugs are spread in the entryway and at the base of the stairs. D, night lights are installed in 2 locations along the upstairs hallway. And E, the bathroom features a grab bar positioned only near the toilet. The answers are letters A, B, C, and E. For letter A, the loose items such as the magazines on the floor can create a tripling hazard, especially for older adults. These should be removed. Now, letter B, what we should have here is adequate lighting. Okay, so if there is a broken light fixture, this can increase the risk of falls, and this should be repaired promptly. Now, letter C, decorative rugs, or known as scatter rugs, especially in the high traffic areas, they are known fall risk for elderly individuals, and this should be eliminated to improve the safety. Now, letter E, bathrooms require grab bars, not just near the toilet, but also in the shower or bathtub to ensure the stability and also reduce the risk of slipping. And so, if you selected letter D, this is the incorrect option. The night lights can improve the visibility and also contribute to the nighttime safety. And so, especially with the older adults navigating the hallways. So you have to focus here and identify those safety hazards that are most likely to cause falls, especially for the older adults. And you have to disregard the option that can enhance the safety, such as the night lights. So that's the purpose of this question. 53. Which short-term goal is appropriate for a client experiencing acute delirium caused by substance use? A, the client will regain awareness of person, place, and time during periods of clarity. B, the client will identify triggers for substance use. And C, the client will acknowledge dependence on substances. And D, the client will adopt healthier strategies for managing stress. The answer is letter A. Acute delirium can often present with fluctuating states of confusion and lucidity. And regaining orientation is the first step in the recovery and an achievable short-term goal. Now, if you selected letter B here, it's incorrect option. Identifying the substance use triggers is essential, but is more appropriate during the stabilization and recovery phase. Same thing with letter C. Admitting dependence is part of a long-term treatment goals, not immediate care. While letter D, learning coping skills, is critical in preventing relapse, but requires mental clarity and should be done when the patient has already been stabilized. So focus on the term initial on the question, and you got to eliminate those options that are related to long-term recovery, and you got to select the goal that reflects immediate improvement in the cognitive function. 54. An older male client with benign prostatic hyperplasia makes the following statements. Which one suggests the need for further education? A, reducing my fluid intake will help me urinate less often. B, I wake up twice nightly to urinate because of my enlarged prostate. C, having an enlarged prostate does not increase my risk for prostate cancer. And D, I may get urinary tract infections due to my prostate condition. The answer is letter A. Because limiting the intake of fluid can lead to dehydration, and take note, it can also cause concentrated urine and will increase the risk of urinary tract infections. Take note that clients with BPH should maintain adequate hydration, not lessen. We have letters B, C, and D as incorrect options. The nocturia is a common symptom, and this is associated with a BPH. That statement reflects understanding. The same thing with letter C and letter D. So you have to look for a statement that contradicts evidence-based management of the benign prostatic hypertrophy, and you got to discard those statements that align with known symptoms or complications of the BPH. Let's have number 55. A client was taught cough pumping exercises to prevent blood clots after surgery. Which activity demonstrates the client understands that technique? A. Alternating pointing toes upward and downward. B. Flexing and straightening the knees alternately. And C. Lifting and lowering the legs repeatedly. And D. Tensing and relaxing the calf muscles alternately. The answer is letter D. The cough pumping exercises involve contracting and releasing the calf muscles to promote circulation and intended to reduce the risk of blood clots. If you selected letter A, this is dorsiflexion and plantar flexion, which primarily stretch the tendons and will not adequately engage the calf muscles. So that's incorrect. If you selected letter B, the knee movements here are focusing on joint mobility rather than the calf circulation. Letter C is also incorrect because this is only raising legs, which will activate the thigh muscles, not the calves. So you gotta identify the option that directly engages the calf muscles. Let's have 56. A client with paranoid schizophrenia who threatened family members was admitted involuntarily for 48 hours. After this period, what must be determined by the psychiatrist and court? A. Whether the client poses a risk to self or others. B. Whether the client is open to outpatient care. C. Whether the client is a danger to himself. And D. Whether the client agrees to take prescribed medication. Your answer should be letter A. The primary consideration during involuntary admission is ensuring safety. The client's potential to harm himself or others must also be assessed in this case. So if you selected letters B, C, D, these are incorrect options. The willingness to participate in outpatient care is secondary to immediate patient concerns, or immediate safety concerns rather. If you select letter C, self-harm is a component of the evaluation, but it does not address the harm to others. Letter D, another incorrect option. The medication compliance is not the determining factor for continued admission. So your strategy here is to focus on the safety as the overriding concern in cases involving violence. And you got to select the most comprehensive choice. Number 57. A client has been prescribed fluphenazine 1 milligram to be taken daily at bedtime. Which nursing intervention is most appropriate to address common side effects of this medication? A. Provide sugar-free gum, candy, and frequent water access during the day. B. Regularly check for confusion during daytime hours. C. Advise the client to get up slowly from sitting or lying positions. And D. Frequently assess for dizziness or faintness throughout the day. Your answer here should be letter A. These are what we call as anticholinergic effects. Okay, we have the dry mouth, which is a typical side effect of the fluphenazine, and you should assist the client in managing the symptom by providing them sugar-free gum or sugar-free candy and also frequent hydration. So letter B is an incorrect option. This is not a known common side effect of the fluphenazine, and the orthostatic hypotension is not a significant concern with the medication as well. So advising this to your client is unnecessary. Now, dizziness or fainting is not a primary side effect of the fluphenazine as well. So you got to recall the medications side effects, and you have to keep in mind that fluphenazine often causes anticholinergic effects such as dry mouth. So you got to eliminate all those other options that will not align with the management of the symptoms. Let's have number 58. A nurse working on a medical surgical unit must delegate a client to the LPN, LVN under RN supervision. Which client is most suitable for a delegation? A 54-year-old with hypertension and stable chronic kidney disease. B, a 46-year-old who had a bilateral adrenalectomy the previous day. C, a 68-year-old preparing for discharge after arthroscopic surgery. D, a 22-year-old with hemophilia and a leg fracture sustained yesterday. The answer is letter A, because the client here is stable with no significant changes in conditions or need for intensive monitoring or, let's say, education. So it makes them appropriate for delegation to the LPN or the LVN. If you selected letter B, this is a patient that is not going to be appropriate. This patient requires frequent assessments due to the potential complications. So this should be managed by an RN. Letter C is also inappropriate because clients that are being discharged requires education and also follow-up care and activity limitations, and this should be handled by the RN as well. Letter D, another incorrect option. This client that has hemophilia and a history of recent fracture will need close monitoring for any complications such as bleeding, in which the RN should manage. So when you are delegating a LPN or LVN, you have to delegate stable clients with predictable outcomes. So always think about reserving unstable clients, those that are requiring frequent assessments or education to the registered nurse. Let's have 59. A medical surgical nurse is assigned to float to the emergency department but has no prior ED experience. What should the nurse do first? A, call the hospital's risk management department for advice. B, refuse the assignment, providing a detailed explanation. C, request that the ED charge nurse contact the nursing supervisor. And D, determine tasks that can be performed safely within the nurse's skill set. The correct answer is letter D. So when a nurse is floated to an unfamiliar unit, the priority here is to ensure the patient's safety while you're maintaining their scope of practice and skill level. And identifying those tasks that are within the nurse's competency will allow them to contribute effectively without compromising care quality. And so this typical approach will show professionalism and also adherence to the ethical standards, and it will also prioritize client safety and also avoids practicing beyond one's abilities. So if you selected letter A, this action bypasses the chain of command, which is essential in resolving such situation. And the risk management may eventually be involved if there are any legal or liability concern, but it is not the initial step when dealing with an assignment, especially for a float nurse. Now, letter B, refusing the assignment and providing a detailed explanation. This is an extreme measure and should only happen if the nurse believes the situation places patients at imminent risk due to unsafe care. And so the nurse should first evaluate what aspects of care can be safely provided, and they have to seek support from the supervisors or colleagues. Letter C is an incorrect option. We know that having the ED charge nurse to contact the nursing supervisor may be appropriate only if concerns cannot be resolved, and this is not the first action. So what should happen first is that the nurse should initially assess their abilities and make sure that they communicate directly with the emergency department charge nurse to clarify their expectations and responsibilities. So you got to prioritize patient safety and also professionalism. You also need to remember to follow the chain of command, and you have to eliminate extreme actions, and you have to focus on feasible and immediate solutions. Anything that can be done safely within the nurse's skill set. Let's have number 60. The nurse observes another staff member's actions after surgery for a child with clubfoot. Which actions require intervention? Select all that apply. A. Administering pain medication as soon as it is due. B. Performing neurovascular checks every 2 hours. C. Covering the cast with heavy blankets. D. Elevating the foot and ankle on a pillow. And E. Monitoring for swelling around the cast edges. The answers are letters A and C. A. Pain medication should be given based on the child's pain assessment, not automatically at scheduled time. So this is something that you should keep in mind. Okay. The question here was to which actions require intervention. Another option here is letter C. Covering the cast with heavy blankets. Well, this is not a good intervention because this can trap the heat and also the moisture, and this will interfere with the cast drying process and will also increase the risk of swelling. So we have the incorrect options here, letters B, D, and E. These are interventions that are actually do not need any correction. Okay. So what you're going to focus here is to identify those options that will compromise the client's healing process. Number 61. A client on warfarin informs the nurse of taking aspirin with propoxyphene for back pain. How should the nurse respond? A. Explain that aspirin can interfere with warfarin and discuss an alternative with the provider. B. Advise that daily aspirin use may alleviate pain but might require a higher warfarin dose. C. Inquire about the duration of the back pain and explore the need for a pain management referral. And D. Recommend continuing aspirin and propoxyphene to prevent a pain cycle. The answer here is letter A, because aspirin can potentiate the warfarin's anticoagulant effect, and thus will lead to increased bleeding risk. The nurse here should educate the client and collaborate with a provider for safer alternatives. So if you select letter B, this is incorrect because when you're increasing the warfarin dosage with aspirin use, this is really going to enhance the bleeding. Letter C as well. We know that assessing pain is important, but it will not address the immediate risk of drug interaction. Letter D, the continuation of aspirin with the warfarin will also disregard the risk of severe bleeding. So take note about the drug interactions between the warfarin, aspirin, and also eliminate the choices that fail to address the critical interaction between the two known drugs, aspirin and warfarin. Let's have number 62. A nurse is about to start total parenteral nutrition for a client with malabsorption syndrome. What initial tasks should the nurse prioritize? Select all that apply. A. Ensure an electronic infusion pump is ready for use. B. Assess for the client's wheat allergies. C. Conduct a baseline electrocardiogram. D. Record the client's initial weight. E. Calculate the client's individualized nutrient requirements. The answers are letters A and D. Letter A, there should be an infusion or IV pump that should be available because this is a critical device in the administration of TPN. It will help deliver the nutrition at a precise rate. It will also prevent fluid or nutrient overload. Letter D, recording the client's initial weight. This is essential for monitoring the effectiveness of the TPN therapy. And take note about the case, we have malabsorption syndrome, wherein there's going to be some form of malnutrition that will be evident. And so the weight trends can also help you evaluate the nutritional status and the patient's response to the treatment. Letter B is an incorrect option because the wheat allergies are irrelevant for TPN rather, since it bypasses the digestive system and it does not contain wheat derivatives. Letter C is also incorrect because a baseline EKG is not routinely required before initiating TPN unless the client has a cardiac condition. And the nutritional calculations for TPN formulas are typically done by the dietitian, not the primary nurse. So you have to focus on the nurse's role in the TPN therapy and eliminate the other options that involve tasks outside the nurse's scope or any other unrelated TPN actions. 63 will follow this. A reminder, we are encouraging you to enroll to the NCLEX course. Kindly visit the website, stankosnclexcoaching.com. Number 63. The nurse suspects a transfusion reaction in a client receiving packed red blood cells. What immediate steps should the nurse take after stopping the transfusion? Select all that apply. A, administer a saline bolus. B, recheck vital signs every 5 minutes. C, run normal saline at a KVO rate. And D, draw a white blood cell count sample. And E, notify the healthcare provider. The answers are letters B, C, and E. Letter B, reassessing the vital signs frequently, let's say every 5 minutes, can help monitor the client's condition during their reaction. And also letter C, keeping an IV line with a KVO rate can also maintain vascular access for any medications or fluids. And letter E, contacting the healthcare provider promptly will also ensure that appropriate medical intervention is initiated. So if you selected letters A and D, these are incorrect because this requires a provider's order. A saline bolus requires a provider's order and not an immediate independent nursing action. Letter D is also incorrect. It's unnecessary in the initial response to a transfusion reaction and should be guided by the provider's orders as well. So your focus here in answering this question is to target those options that will be of immediate independent nursing actions during a transfusion reaction. Okay, and you have to discard those options that will require provider authorizations or order. So what you are going to answer this question, you have to eliminate each option. Let's say asking yourself, is this a true or is it a false statement, to evaluate each action. 64. A client with low hemoglobin and hematocrit needs a unit of packed red blood cells. The nurse notes the client has an oral temperature of 100.8 degrees Fahrenheit, 38.2 degrees centigrade. What is the nurse's best action? A, give an antihistamine and proceed with the transfusion. B, administer acetaminophen and start the transfusion. C, initiate the transfusion as ordered. And D, hold the transfusion and notify the healthcare provider. Your answer here should be letter D. A fever may indicate an underlying infection or an increased risk of a transfusion reaction. So your goal here as a nurse, you have to notify the healthcare provider, who will determine whether to proceed or treat the fever first. So if you selected letter A, it's incorrect. Antihistamines do not treat fever and cannot be given without a provider's order. Letter B is also incorrect. It can treat the fever, but cannot be independently administered by the nurse. Letter C, is also incorrect because starting the transfusion without addressing the fever could increase the risk of complications. So you have to focus on prioritizing safety in this case, eliminate those options that involve administering medications without an order or ignoring signs of potential complications of a blood transfusion. Now, let's have number 65. During a home visit for a stroke client with left hemiparesis, which observations suggest the need for additional teaching? Select all that apply. A, hand weights are positioned near the couch. B, a small rug is placed beside the bed. C, a commode is available at the bedside. D, a fluid restriction chart is on the fridge. E, psyllium is stored on the kitchen counter. The correct answers here are letters B and D, because B, small rugs, are a tripping hazard and it can increase the risk of falls, which is especially concerning for these stroke patients with mobility issues. And letter D, fluid restrictions are often short-term after a stroke and not typically a necessary post-discharge action unless it's specifically ordered by the medical provider. So the incorrect options here are letters A, C, and E. We know that hand weights can support strength building exercise and rehabilitation. Also, the placement of the bedside commode is also practical for clients with limited mobility. And with letter E, this will help in a bowel regularity and is also appropriate for clients with reduced activity levels. So you have to look for those items that conflict with the safety or current care recommendations and make sure that you eliminate options that support safe rehabilitation practices, because that's the goal of this question. Observations suggesting the need for additional teaching. 66. A 1-year-old child has been diagnosed with cerebral palsy involving spasticity in all limbs. What would be appropriate areas of concern for this child? Select all that apply. A, difficulty forming words or speaking clearly. B, concerns about body image or appearance. C, potential for accidental injuries. D, challenges in self-feeding efforts. E, cognitive difficulties or issues with thought processes. The answers here are letters A, C, and D. Letter A, it's because spasticity is common in cerebral palsy and can interfere with muscle control needed for speech development. And since a 1-year-old is at the stage of beginning to develop their language skills, these challenges may also manifest as difficulty of forming their words. And letter C, the muscle tightness and also the lack of coordination associated with a spastic cerebral palsy may also increase the likelihood of falls or other injuries. Now, letter D, the spasticity affecting the arm and hand movements can make self-feeding particularly challenging, as we know that fine motor control is limited in this case. So if your answers are letters B and E, these are incorrect because a 1-year-old is not developmentally capable of experiencing self-consciousness or concerns about body image. And this level of cognitive emotional development typically occurs much at a later time. Now, letter E is also incorrect because the thought processes in a child this age are difficult to evaluate because the cognitive abilities are still in the very early stages of development. So you need to focus on what is developmentally appropriate for a 1-year-old child while also considering the impact of spasticity on the physical abilities. And make sure that you eliminate those other options that involve advanced cognitive and emotional development. Let's have number 67. When monitoring an adult client undergoing treatment for fluid overload, which findings indicate that the therapy is effective? Select all that apply. A, clearly audible S3 sound. B, clear breath sounds on auscultation. C, strong bounding pulses in the extremities. D, flat neck veins with the head elevated. E, delayed emptying of hand veins greater than 20 seconds. The answers are letters B and D. Letter B is correct because the fluid overload often causes crackles in lungs due to pulmonary edema. And the absence of these sounds with clear lung fields signifies that the fluid balance is returning to normal. And also letter D, flat neck veins when the head is elevated also indicates that there is absence of venous congestion, which is a sign that fluid overload has resolved. So you're going to eliminate the incorrect options here, letters A, C, and E, because S3 heart sound is a sign of fluid overload. It's not a sign of resolution of the issue. Letter C, strong bounding pulses in the extremities. This is also a sign of fluid overload, which is inconsistent with effective treatment. And letter E, delayed emptying of the hand veins, also reflects persistent venous congestion and excess fluid in the circulation. Let's have number 68. A client with burns covering 30% of the body is assessed 18 hours after injury. Which fluid and electrolyte imbalances are likely present at this stage? Select all that apply. A, fluid overload. B, elevated calcium levels. C, fluid volume deficit. D, high potassium levels. E, low potassium levels. The answers are letters C and D. Letter C, it's because hypovolemia is common during the initial phase of burn injury due to the significant fluid loss caused by the capillary leakage and also the inflammation. And same thing with letter D, high potassium levels can occur due to the cellular damage from the burns, which will cause the potassium to shift from inside the cells to the bloodstream and leading to the hyperkalemia. So if you selected letters A, B, and E, these are incorrect. Letter A, fluid overload is not typical in the early stages of burn injury because of the widespread blood loss into the tissues. Letter B, calcium levels are more likely to decrease due to the fluid shifting rather than an increase. Letter E is also incorrect because potassium levels are usually elevated, not reduced. Take note that with a cellular injury, this will allow the potassium to be released into the bloodstream. Okay. Let's have number 69. Which potassium chloride order should the nurse question for a client with severe hypokalemia? A, administer 1,000 ml of normal saline with 40 milliequivalents potassium chloride IV at 200 ml per hour. B, give 20 milliequivalents KCl IV over 10 minutes. C, infuse 1,000 ml of normal saline with 20 milliequivalents KCl IV over 8 hours. And D, provide 20 milliequivalents KCl orally after meals. The answer is letter B, because the rapid IV administration of potassium, we call that bolus or push, it is strictly contraindicated because it can cause life-threatening arrhythmias and it can lead to cardiac arrest. So take note about the safe administration of IV IV potassium replacement in hypokalemia. It should not be greater than 10 milliequivalents per hour for peripheral IVs, or should not be greater than 20 milliequivalents per hour if administered via central line with a cardiac monitoring. Anything faster than those rates will be unsafe for your patient. Right? So if you selected letter D, this is something that you should not question, because oral potassium replacement is also safe and also effective when taken with meals to minimize gastric irritation. The same thing with letter C, infusion of 1,000 mL of normal saline with 20 milliequivalents KCl over 8 hours. This infusion is a standard rate and also a safe practice. And the same thing with letter A. This rate of infusion is also within the recommended guidelines. Let's have number 70. A nurse assesses a client for signs of increased magnesium levels. Which finding suggests that hypermagnesemia is not present? A. Slow heart rate. B. Supraventricular tachycardia. C. Flushing and sweating. D. Low blood pressure. The answer is letter B, because SVT is typically associated with low magnesium levels, not high magnesium levels. And the reason for that is because magnesium deficiency can increase the excitability in the heart, which can lead to tachyarrhythmias. And so if you selected letter A, that is incorrect, because it is a hallmark of hypermagnesemia due to the depressive effects on the cardiac conduction. Letter C is also incorrect, because flushing and sweating occur with high magnesium levels due to vasodilation. The same thing with letter D. Low blood pressure is a common symptom in hypermagnesemia. It's because of the vasodilation. Let's have number 71. To minimize the risk of early postpartum hemorrhage in a client who just had a cesarean birth, the post-anesthesia care nurse should include which measures in the plan of care? Select all that apply. A. Assess abdominal dressing for drainage. B. Monitor urinary output. C. Monitor the drainage on the client's peri pad. D. Maintain an IV rate of 125 mL per hour. And E. Assess the uterus for firmness every 15 minutes. The answers are letters C and E. Letter C is correct, because monitoring the drainage on the peri pad is very crucial for detecting early postpartum hemorrhage. We know that excessive bleeding will be evident on the pad, and it will allow the nurse to intervene promptly and prevent complications. E is also correct, because the assessment of the firmness of the uterus every 15 minutes can also ensure that uterine contraction is happening. And so if the uterus is boggy, it's soft, this can result to hemorrhage, and you need to make sure that you are detecting this boggy uterus to act on it as early as possible, and in order for us to administer the needed medications to stimulate the contractions. So why is A incorrect this time? We know that the assessing or the assessment of the abdominal dressing is important after a C-section, but it does not directly address the risk of postpartum hemorrhage. Take note that the hemorrhage will happen vaginally, okay? And so hemorrhage is primarily related to the uterine tone and vaginal bleeding, not abdominal incision dressing drainage. So eliminate that one. Letter B is also incorrect. We know that monitoring of the urinary output is also important, but it's only important for hydration and kidney function, but it's not going to specifically related to the early detection or prevention of the postpartum hemorrhage. Okay. Letter D is also incorrect, because maintaining an IV rate of 125 mL an hour is necessary for hydration, but it will not prevent or help detect postpartum hemorrhage. We know that the IV fluids can help the circulation, the overall hydration, but will not directly address the hemorrhage management. All right, so your strategy here is to focus on postpartum hemorrhage risk. Again, take note about the uterine tone, and also assessing the firmness of the uterus every 15 minutes. Let's have number 72. What would the postpartum nurse expect to document about the client's lochia and location of uterine fundus on the second day after delivery? A. Pinkish brown leukia with no clots, fundus midline, and 4 finger breadths below the umbilicus. B. A large amount of bright red leukia with large clots, fundus midline, and at the umbilicus. C. Yellowish white leukia with no clots, fundus 3 finger breadths below the umbilicus. D. Dark red leukia with small clots, fundus midline, and 2 finger breadths below the umbilicus. The answer here is letter D. On the second day postpartum, the leukia should be dark red. That's the leukia rubra with possible clots. And the fundus is expected to be about 2 finger breadths below the umbilicus, which reflects the normal involution process during this time. So if you selected letter A, this is incorrect. The pinkish brown leukia, this is what we call as serosa. This typically can appear around days 4 to 9 postpartum. So this is incorrect for day 2. And in addition to that, the fundus should not be 4 finger breadths below the umbilicus on day 2. For letter B, the reason why it's incorrect, because bright red leukia with large clots, it's not typical after the first day of postpartum. The presence of the large clots in the fundus of the umbilicus suggests possible complication. There could be uterine atony and also hemorrhage. Letter C is also incorrect because the yellowish white leukia, this is the alba, this can happen much later in the postpartum period and typically around day 10 or later. And the placement of the fundus should be lower than 3 finger breadths below the umbilicus by day 2. So take note about the leukia progression in 3 stages. Take note about the leukia rubra or dark red color. This is the first stage. This is from day 1 to 3. We have the leukia serosa, which is the pinkish brown. It can occur during days 4 to 9. And leukia alba, which is the yellowish white drainage. This is going to happen around day 10 and will continue until the end of the postpartum period. And as far as the fundus placement, the fundus, which is the top of the uterus, should be at or just below the umbilicus in the first few days postpartum. And so by the second day, it should be about 2 finger breadths below the umbilicus. Alrighty, let's have number 73. A postpartum client receiving heparin asks whether she can continue to breastfeed. What is the best response for the nurse to give? A. She can continue to breastfeed, but must assess the baby daily for ecchymotic spots. B. Heparin will not affect the breastfeeding and requires no special precautions for the infant. C. She should alternate breastfeeding and bottle feeding. D. She should stop breastfeeding immediately. The answer is letter B, because heparin does not pass into the breast milk in significant amounts. So the breastfeeding can continue without special precautions. And so this makes it the best answer. Alrighty, let's have number 74. A client with esophageal cancer arrives in the emergency department with shortness of breath, tachycardia, hypotension, and cyanosis. Cardiac tamponade is diagnosed. Which intervention would the nurse expect to include in this client's care? Select all that apply. A. Insert an intravenous catheter for IV access. B. Monitor urinary output. C. Prepare to assist the healthcare provider with a thoracentesis. D. Initiate oxygen therapy. And E. Administer a vasodilator agent IV. Your answers here should be letters A and D. Letter A, IV access is very important for the IV fluid administration and also the administration of the medications and potentially vasopressors to help support, stabilize the client's hemodynamic status during the cardiac tamponade. And the same thing with the administration of the oxygen therapy to address respiratory distress and also cyanosis associated with cardiac tamponade. And so we need to improve the oxygenation of the client right away to reduce hypoxia. Why letter B is incorrect? Well, we know that this is important for hydration, but it's not a priority intervention for managing cardiac tamponade. What our focus here is stabilizing the cardiovascular and respiratory systems. Letter C is also incorrect. Cardiac tamponade requires pericardiocentesis, not thoracentesis. So eliminate this one. We have letter E, administer a vasodilator agent intravenously. This will significantly reduce the blood pressure further and can worsen the hypotension. So we have to eliminate this option as well. 75. The nurse reads in the medical record that a client's tumor is at stage T2 and 0 M0. The nurse should draw which conclusion about the client's status? A. The client has an advanced tumor with an indication of involvement of lymph nodes, but no indication of metastasis. B. The client has an advanced tumor with an indication of metastasis, but no indication of involvement of lymph nodes. C. The client has an advanced tumor with metastasis. And D. The client has a measurable tumor with no indication of metastasis or involvement of nodes. The answer is letter D. Let's take a look into the numbers here. T2, it indicates a measurable tumor. And the N0 means there's no regional lymph node involvement. And the M0 indicates there's no distant metastasis. And so this describes an early stage tumor with localized finding. Now, if you selected letter A, this is incorrect because the N0 stage indicates no lymph node involvement. The tumor is not advanced and there is no evidence of metastasis. Letter B is also incorrect because the presence of metastasis, M0, contradicts this statement. We know that M0 means there is no metastasis. And in addition to that, the T2 suggests a measurable localized tumor. It is not an advanced one. Letter C is also incorrect because T2 does not indicate an advanced tumor and M0 means there is no metastasis. So recall the TNM staging system and what each letter and number means. So for this type of question, you need to understand the significance of T2, N0, and M0 to help you conclude that the tumor here is still localized and not advanced or metastatic. So this is the end of our session today. So again, we are inviting you to enroll to the NCLEX course by visiting the website, NCLEX So I'll see you again in our next episode of NCLEX series. Thank you and have a great day.